वक्ताओं को लेके नई नई वेबिनार का प्रारंभ करते हैं। ओवर टू पवन शर्मा जी। नमस्कार, सभी का स्वागत।
नमस्कार, बहुत बहुत आभार। हम आयुष समृद्धि की पायदान नंबर 914 में आपका स्वागत करते हैं। भगवान धन्वंतरी को, शिव को और माँ पार्वती को धन्यवाद देता हूँ कि उन्होंने ऐसा विजुअलाइजेशन दिया, ऐसा कंसेप्चुलाइजेशन दिया और ऐसी एक प्रेरणा दी कि हम आप लोगों के सहयोग से एक एक दिन में 3-3, 4-4 वेबिनार करने में सफल हैं। आज सुबह से चरक की आराधना शुरू हुई थी डॉक्टर विपिन पांडे जी के चरक संवाद के द्वारा। 7 से 8 वो था। आज अभी चरक जयंती की हमने एक पायदान को पार किया है, जो कि एक शुरुआत थी चरक पक्ष की 15 दिनों के लिए। और आज उसी कड़ी में, उसी तारतम्य में हम तीसरी वेबिनार आयुष केयर फॉर सीनियर सिटीजन्स, आज सीनियर सिटीजन्स डे है और बड़ी बात है कि आज हम उन्हीं को बुलाते जा रहे हैं। आज न्यूक्लियर फैमिली में, सॉरी, फ्रॉम श्रीलंका, डॉक्टर केसी प्रियदर्शने गुणरत्ने जी is there. So I would like to communicate. I would like to welcome all the speakers. Thank you, Dr. K.C. Priyadarshini ji, Dr. Dhruv Prasad ji from Sri Sri University Cuttack, and Dr. Tejendra Singh ji from Dehradun. Really, we are grateful to you all because due to regular exercise, I am unable to give long notices, and I am really overwhelmed with your support, mentorship, and everything that we are able to conduct this 914th webinar within these 3 years. Thank you very much again for joining, and I would like to request all the audience to stay with us because this will be a unique subject, next 1 hour only, and we are daily changing like episodes. So the interest, the creativity, the audience attachment, everything can be revived and everything can be made interesting for the audience. Thank you very much, Dr. Priyadarshini ji, Dr. Dhruv Prasad ji, and Dr. Tejendra Singh ji for joining us again. I would like to request Professor V.K. Agnihotri sir for his brief preamble, as Dr. K.C. Priyadarshini will also support the English medium. So definitely we will try to conduct this webinar at international level. Welcome all again. Agnihotri.
Thank you, sir. Thank you, Professor Pawan Sharma ji. Thank you so much. And we are tirelessly continuing the third webinar on today itself.
Fourth of the day, sir.
Fourth, right from very early 7 a.m. and until this 10 p.m. It's the fourth one in the continuation, of course, having other programs in daytime. So, well, we are always grateful for our seniors. We were child, now we have become seniors, but at the same time, commitment for seniors, responsibilities for seniors, and everything in the respect of seniors is very, very important. It is a must for every progeny. What I am feeling that where stands the Ayush? Ayush is here to make all efforts, to give all instructions to the doers, performers, seekers, and all the guidelines for our seniors. I would like to, first of all, thank Dr. Professor Ramakant Raut ji for making us available Dr. Dhruv Prasad ji as a guest speaker on today. And I would like to request Professor Pawan Sharma ji to make him Dr. Dhruv Prasad ji co-host so that he will be in position to make the PPT presentation on his presentation time. At the same time, I am very thankful to Dr. KC Gunaratne. She is coming from Sri Lanka, and very honorably, as she studies here in NIA Jaipur, did MD, MS in Shalya. So she knows in Hindi, but for her support, we are here to make the language and knowledge available in the same language as she understands. Along with Dr. Tejendra Singh, one of our very good friend, student, MD scholar here from Dehradun College. We all welcome all the 3 guest speakers tonight. and our gratitude for their late joining itself, their commitment for our presentations purpose. I really feel very honored and very hopeful they will always be with us. So topic is very important. We are all here to listen. Whatever you are going to project, how the senior citizen should be taken care of. This is very important from the side of the Ayush. So thank you very much, and over to Pawan Sharma. Namaskar. Welcome.
Thank you very much, sir. Welcome, Dr. Dhruv, on our first time on our platform. Now stage is yours. You can share your presentation if you have. Agnihotri sir, kindly take care for 2 minutes.
Have you uploaded your presentation, PPT stuff, Dr. Dhruvji?
I request Madam to start over. Meanwhile, I'll just have some issues. Let Madam start, then I'll do it. Next,
you want to ask Madam to start first?
Yes, yes, yes,
Is
yes.
it?
Yes, yes.
Madam, would you please give this favor to start?
Done.
He's getting some problem for connection.
No,
so,
done.
He's getting.
Oh.
Luckily, he got it. Okay, ma'am. Probably he will continue.
Sorry for that.
Don't lose heart so easily. Don't lose heart so easily. Be courageous.
This is your platform. Technical glitches will be always there.
No problem.
This is your platform. Welcome.
इतनी जल्दी हार नहीं माननी है. आप पहली बार तो आपके लिए हम लोग खड़े हैं ना. कोई नर्वस होने lose heart की no problem. You please continue. We will give you time and you can start as long this takes place. You can start virtually as an introduction and all this.
It is being seen, sir. It is shared.
Yes, it is shared. Yes. Great. Start. Continue.
So, namaste.
You can go for slideshow.
Yes. Namaste to all. Respected professors, respected Agnihotri sir, Pawan sir, and all senior faculties and others. So this is my first time presenting on IRES. So today I'm going to speak on Ayush care for senior citizens with respect to diet and lifestyle. So myself, Dr. Dhruv Prasad, I have a short introduction of myself. I'm working as an assistant professor in Sri Sri College of Ayurvedic Science and Research Hospital, Sri Sri University, Cuttack. So basically, I'm from Kerala, and so today I'll be speaking about Ayush care for senior citizens with special reference to diet and lifestyle. So coming to the introduction, as today, so I wish everybody a World Senior Citizens Day. So this is the time for senior citizens to celebrate life, and as we know, it is celebrated. This day is celebrated to highlight the contribution of the elderly people in our lives and society. The occasion is dedicated to celebrating the senior citizens who form an integral part of family and society and nation. So, as we know, aging is a natural.
The volume little bit. आपकी आवाज
हल्की
है. ये तो माइक के पास कर लीजिए.
जी. So, aging, as we know, aging is a natural process. Everybody has to go through aging, and unfortunately, most of us are not able to accept the grim truth that we will also become aged one day. We will also become senior citizens one day. The kind of abuse we have in the society, it's very saddening and very, very difficult to see. People come to us and they start crying and they start sharing all their problems. So it is high time. I'm really thankful that we are able to talk about this important topic about the senior citizens and their lives. So just a general statistics, maybe from the Swasthavarta background. So we are aging much faster. The world is seeing, the population is seeing aging to be very fast recently. In the last 50 years, we were about 2.1 billion we were about 0.5 billion in 1990. Now we are almost crossed 1.2 billion. Now we'll almost expected to reach 2.1 billion by 2050, and by next 100 years, that is 2100, we'll be reaching about 3.1 billion. So this is massive. We can see the population growth. The countries which is having older populations like China, and currently It is interesting to know that Europe is the continent. Europe is the continent which is having the higher older population, and among the countries, if you see the world statistics, Monaco, a small tiny country near Europe, has the highest population of elderly citizens, and followed by Japan and a small island called the Saint Helena, Italy, Finland, Portugal, and Greece. But compared to the Asian countries, the quality of life in those countries are much better than our countries. And coming to the grayscale senior citizen, you can see the share of population. It was just 5.4%. Now it has reached that is 19%. That is, we have come from 20 million to 300. We are going to reach 324 million by 2050, according to the present statistics. And there are expected to be about, currently there are about 100 million elderly citizens in India currently. So, and the number is expected to triple by 2050, according to the current estimates. And most of the senior citizens, either they stay alone, or two elderly citizens, they live by themselves, or they don't have anybody to be with them. So if you see the state-wise statistics, most number of senior citizens you can see in Tamil Nadu, Andhra Pradesh, then Chhattisgarh, MP, Odisha, Jammu and Kashmir, Haryana, Punjab, Delhi, Assam, etc. And more than 80 years, only few states have more healthy and people who cross more than 80 years. That is also very less. Only 1.6% of the population are above 80 years, and mostly from the states of Punjab, Haryana, Maharashtra, and Kerala. Only a few states where there's a sizable number of people who live above 80 years of age. So generally, coming to the health, health elderly means there's Vata Prakopa generally, and there's common health problems than any other child, any other age would, like young age or middle age. Most number of health problems are encountered in the elderly people. So commonly elderly diseases can be classified into physical, mental, can be social health problems, or it can also be emotional health problems. Then coming to the physical health problems, elderly people will have, by prakriti, by default, they'll have vata prakopa, and by they'll be kafakshaya. So they'll be, although all the tissues will start losing their innate strength, organs, body will lose its natural luster and all these things. And there's no numerous number of diseases like diabetes, cardiac problems, joint problems, degenerative disorders, all impairments like hearing impairments, then poor digestion, then the immunity will also be generally low. So they'll be having repeated chest infections, vision impairment. Then they'll have some prostate trouble. Then they'll have recurrent UTI and all the other problems. So there's a package of chronic illnesses which usually affect the old age people, and they're not much prepared to tackle it. So that was about the physical problems. So that is not the only thing which affects the elderly. We have some mental problems like, you know, elderly people have so much issues. So they are exposed to depression, and they have memory loss, and they have more fear, because at that age, usually there's a change in their personality, because they are lost out of the job after 60. They get into a lot of troubles, then security issues and sleeping issues, and so many problems come in their lives. So there's a lot of mental issues. Then coming to the social health problem, this is most neglected actually. So there are a lot of social health problems which we encounter in the elderly. They have loneliness, then they're not able to express their loneliness, like they are not able to tell, nobody's bothered, or even though they're bothered, they're not able to spend time with others, and they're not able to do regular activities. They need some help. They need some help with others, and then they have some difficulty in coping with changes in aging, all the changes which happen. They're not able to cope with that. Then they have some medical problems. So like every time they should meet a doctor, and they're not able to go to the doctor all of the alone. They need some support. So everything make they become very frustrated. So there's a lot of social health problems in their lives. Coming to they're also socially isolated. Like family members will not have, they'll be busy with, today we have living in a very modern world where everybody is very busy. So like may feel very much neglected, or they are not taken care properly. and they also feel they might feel inadequate from the because they are not able to work like before. So everything becomes shaya. So like they're not able to work as fine as they used to be. So they have all such problems. Then post retirement, they have usual boredom, how they spend their time, and so even financial stress is there because after retirement they lose their job by default, and regular income is lost. So overall, there's complete stress to them. So most important, first important in elderly care, in what we can do is we can first is to give some proper care. That is the first best thing we can do. Take care of them, take good care, communicate with them properly, spend some nice time with them, take them to some outside places where they get free and they get happy. So most important thing, me from Swasthavatta perspective, I thought that why not share some foods which by which because Ahara Nidra and Brahmacharya are Trayopastambha. So basically looking at the so basically food is also an important part in the elderly aspect. So we should plan some foods which by which they can easily digest. So instead of giving usual normal foods, we can plan a plethora of foods like red rice. You know, red rice has the highest nutritional value. We can make some ganji or like gruel, which we call, which is easy to digest, which is very nutritious, and it contains very high amount of antioxidants and reduce free radicals in the body. And so because they also by having good food also they'll be having proper nutrition, the calcium levels will be maintained, which is very important. And they'll have good electrolytes also. This semi-solid it is good for the body, and easy for digestion also. They'll not feel hunger. And since in old age generally the hunger is bit less, they have bit of constipation, all these problems. This is very good actually. Red rice, this is very commonly used in Kerala, and nowadays it's also used in other places because of its high health value. So instead of the normal white rice, polished white rice, which is highly polished and it's also polished by chemicals, it is better to go for some natural rices like red rice or brown rice. You can choose. This is good for the body and natural. It doesn't have any side effect also. This is very beneficial for the old age people. Then simple next recipe which we can advise for the old age people is we can give some Udgayusha also. As you know, moong is the best among the pulses, and you know even comparing Charaka's time in Ayurveda or even in modern, this is very good, easy for digestion. Even we can give this for fever also. So moong dal is it's a very good choice for elderly people because it is cholesterol free, it is having low sodium, high fiber, and most importantly, it is easily digestible and it is highly nutritious. So whenever you plan a diet for the elderly, it is always advised that let them take some because usually if you give only rice and other things, they may get bored and their appetite also may get affected. You can make some moong dal, add some slight pepper and so it can even boost their appetite also on a regular basis. So this can be served weekly, twice or thrice, which is very nutritious and it can supplement the necessary proteins for them for their health. So one more nutritious food which we generally neglect, and nowadays millets and all everything is coming up. So along with that, this kolatha, that is horse gram, is one of the traditional health foods which is coming, which is people are rediscovering again, not discovering, people are rediscovering again. Health, which is it has been used since ancient times for many diseases like kidney stones and breathlessness, and it is very good. Even it prevents heart disease also. So if we make some soup, so this is easily digest more. My concern is that if you give as such, it may become difficult for them to digest. So we can make some soup and we can make it to Krita Yusha. So we can feed them like twice or thrice to supplement their nutritional needs also. As you know, it has calories that is 3 times of chicken, then calcium that is 10 times of milk, proteins that is twice of the egg, and a high amount of phosphorus also. So all these things will help to maintain their good health. And one more superfood which I found which is very beneficial for the elderly is Yava. So nowadays, as I told, it is a general trend to give only either wheat or multigrain wheat or rice. That is. So let us break that taboo and let us try some different recipes which is good for their health. So Yava is since Vedic times we have been using Yava. But nowadays we are more shifted to other items rather than Yava. So Yava is one of the very good healthy foods which we can easily prepare, like Yava Yusha also we can prepare. and we can administer to the elderly citizens, as it is rich in dietary fibers, that is 62%, carbohydrate, that is 26%, and it is rich in very vitamins and micronutrients also. Also, it is very healthy also. So we can plan such alternative recipes. So ragi, it is very popular in South India. Ragi, it is one of the finger millet. It is one of the very popular and very healthy dishes. It is rich in calcium and other essential micronutrients. So we can make ragi roti, can make ragi idli, can make. And our former prime minister, who is his health is attributed to the. He's almost 90 plus years. His health is attributed to the regular consumption of ragi, it seems. So then we can also advise the steamed vegetables and vegetable soup for the elderly, because it contains all the vegetables, is essential to prevent from all the nutritional disorders. So this also it will supplement in maintaining their health. So buttermilk is also one of the healthy recipes which we can advise to the elderly people, because elderly people will have usually will have chest burn, acidity, and most importantly they'll have constipation and piles and other problems. And most importantly, this helps to prevent rehydrate the body and helps to prevent dehydration and helps to prevent blood pressure and cholesterol, and it also helps to supplement the essential calcium which is required in the body. And in Kerala, we have a tradition of rather than drinking normal water, we advise to take some medicated water. So normal water is good, but instead of that, you can add some herbal water like Padmaka, that is Padmaka we give to and other drugs like jeera, ajwain, or ginger. As per the conditions, we can give. Not only this is appetizer, normal hot water is an appetizer. If you add some medicated water, since old age people will have some issues with their gut and the digestion will be a bit low, having some medicated water also will help to improve the digestion, even will be good for the stomach. And there are some anti-aging drugs. It is आयुष्य पौष्टिकी धन्यम वैस्थापनी परम सर्व रोग प्रशमनी बुद्धि इंद्रिय बलप्रदम. So these are one of the two super drugs, super herbs which I found for anti-aging property. It can also help in all the vikaras. That is one among the trifulas. That is, this is haritaki and this is amlaki. The difference is that haritaki is ushnavirya and amlaki is shitavirya. Both are even trifula is good in general. It can be consumed by the old people as this is the rasayana. In particular, haritaki is good, and amlaki, this also can be consumed once in a while. So it can also prevent the constipation and various other disorders, which is very commonly seen. And also supplements a good amount of vitamin C. In coming to the lifestyle, normally since old age people
Only
have
5 minutes left, Dr. Dhruv.
yes, sir, yes. I'm going to conclude it. I am fine. I'm going on with the times. So we have some lifestyle modification. Not only internally, I have told about food. We have some lifestyle changes like abhyanga should be given mandatory. Even at home, they can do some local abhyanga, or if it is possible, we can do some sarvanga abhyanga to the body with shirabala taila or dhanvantaram taila. And even shirodhara is good because they have some mental stress, etc. So regular shirodhara also we can plan. So that will also help to reduce the vata in the body. And all these things will not only nourish the body, it will also prevent the vata from derangement. It also will help to provide good nourishment and good sleep also simultaneously. So especially if they are not able to go for Sarvanga Abhyanga, at least they do Shiro Abhyanga and Pada Abhyanga, as told by Acharya Lord, but it prevents the aging and prevents the stress. So most important feeling that old age people feel is that they feel very lonely and isolated. So what I feel is that we should encourage some old age schools, which is like communities where they can meet each other and they can have some games, read some newspapers, have some learning stuff, all these things. Where even we can have some Ayurveda therapies also. That's things we have to promote as a individual. Then so concluding in this presentation is that aging, we can't stop aging, but simple things we can take care of them. First, give good care to the elderly citizens by giving good love and care. Then, as I told him, let us focus on the simple diet, its various macro and micronutrients. And apart from that, let us provide some external therapies like Abhyanga, Shirodhara, and let us encourage them to join some old age schools where they can get together, have a happy life. let them not suffocate in being in a room or a flat, etc. So, thank you.
Thank you very much, Dr. Dhruv. Very nicely presented. You have covered more excellent food items, and definitely after 70, 60, these are the only amrats, and everybody is avoiding these. So they are ill, really. Please do join. You are from Kerala.
I'm from Kerala.
Yes, Onam is coming.
Onam
Be
is coming.
prepared for that with your team. We need 3 speakers with you. Onam Scientific Festival.
Sure, sir.
I will wait for your response.
Sure,
Welcome.
sir. Sure. Thank you, sir.
So now I would like to request Professor Dr. K.C. Priyadarshini Gunaratne ji from Yakala, Sri Lanka. Welcome, welcome, madam. Thank you, Dr. Dhruv.
Thank you.
Hi, Bhavan. Good evening, sir. I welcome you all dignitaries on the dais and off the dais and all other participants. Then today I'm going to talk about Ayurveda surgical care for senior citizens. As a surgeon, actually, I must talk about especially interest in surgical care because they need normal chikitsa as well as surgical chikitsa. So this is the my bird view of the topic: common problems for senior citizens, manage health problems of senior citizens, panchakarma for senior citizens, patyahara, patyavihara, summary and conclusion. So in our country, actually, we are getting retirement after around 60 years. And normally, I think in the worldwide, we are telling that senior citizens after 65 years. But in Ayurveda, we are happy to say we are telling senior citizens after 70 years. So what are the common medical problems? Earlier also previous have mentioned, but I am going to brief that Agnimandya, Swapna Vishamata, dementia, paralysis or strokes, diabetes, cardiovascular diseases, vision problem, hearing problems, Sandhishula, etc. If I consider about what are the common surgical problems, they are prostate enlargements, malabaddhata, urinary problems, andravuddhi, arbuda, cholelithiasis, osteoporosis, wounds, and kidney failure. Then I'll go one by one, somewhat detailing. That prostate enlargement, what are the symptoms they will tell with us? That poor urine flow, then incontinence, dribbling, hesitancy, dysuria, incomplete evacuation, forceful urination, sometimes hematuria. Then what kind of management we can do from Ayurveda? Vata pacification, then strengthening urinary system, relieving symptoms, and shrinking of the gland. Then what are the do's? They must follow. Urinate as soon as the urge arises, then remain sexually activities, then take time to urinate when it is convenient, even if there is no urge. Make frequent stop to urinate in long trips. Sit on hard seat or chair whenever possible. Daily drink 8 glasses of water. Avoid dampness or coldness temperature. Control stress and do pelvic floor muscle exercises. Then don't control the natural urge of urine. Do not drink liquid too much close to the bedtime. Then vata increase factors just like alcohol, tobacco, smoking, and coffee. Then food which cause constipation and mental exhaustion at workplace, at home. Then we'll see the malabaddha, that is very common thing with senior citizens. The causes for that malabaddha, that is excess intake of rough, dry, and light foods, then inadequate water intake, long-term sitting, lack of fiber diets, colon obstructions just like cancers, intestinal obstructions, sedentary lifestyle, long term using medicines, some kind of medicines, they are having complications just like constipation, then irregular eating patterns, endocrinological reasons and neurological reasons. Then what are the symptoms they are having? That means they may be having defecation less than 3 times per week. Sometimes they're having dry and hard stools. They have to strain to defecate. Then incomplete evacuation, feeling a block in the rectum. Then they need abdominal pressure to defecate and manual removal of stools. A lot of old people, they have told me they are doing that defecation with manual removal. So it's very sad story to hear. So what are the complications they may be getting if they're having constipation for a long time? Hemorrhoids, anal fissures, rectal bleeding, fecal impaction, bowel perforation, adman. Then what kind of management we can do as surgeons? Vata anulomana chikitsa, then vata shamana chikitsa, mala virechana chikitsa, abhyantara sneha, bahya sneha, then avagaha with vata shamaka kwata, then patya ahara and vihara. Then most are coming with antravuddhi, especially male patients. Some females also. Males, they are having inguinal hernia. The same time that females, they are coming paraumbilical hernias because of persisting cough or asthma, then excess pressure while passing feces, then straining abdominal muscles by lifting heavy objects because of their obesity, then prolonged gastritis, that means they are getting that adman. Then what are the chikitsa we can do for them? That's sneha abhyanka, then virechana karma, niruha basti, and vatanulomana kriya. Then most of the patients, they are getting arbuda, that means kind of cancers, mostly that males, they are getting prostate cancers, sometimes that oral cancers and skin cancers, especially females, they are getting breast cancers and cervical cancers at their late stage of their life. So sometimes colon cancers also, some are having bowel cancers also, maybe having lung cancers and bladder cancers. So what kind of management we can do for them? That Grandhihara Chikitsa, Vasti Karma, Virechana Karma, Vamana Karma, Rakta Mokshana, yoga, then massage treatments, relaxation, change eating habits, change in lifestyles and adequate exercises we can ask them to follow. Then some lot of elderly patients coming with cholelithiasis because of intake of anti-conceptional medicines, then malfunction of the gallbladder, then it's excessive amount of cholesterol, overweight or underweight, and the fasting. So what kind of symptoms they are getting? Yellowish skin or eyes, but it's not present at the early stage. Then sickness or reteching, then clay colored stools, pain in the right upper quadrant of the stomach area, nausea, vomiting, and other digestive issues, and sometimes associated with fever. Then the chikitsa we can do apatarpana, langana, virechana, and vata anulomana. Then other than we can manage with well-balanced diet, regular exercises, control stress, and control madhumeha. Then most of the patients, they are coming with osteoporosis. Mostly they are coming with joint pains and difficult to move their joints. So what are the risk factors? Especially that bone density will decrease after 30 years. So because of that late age, they are getting very less bone density. Gender-wise, that women over the age of 50 are most likely to develop these problems. Then family history, bone structure and the body weight also influence of it. Then fracture bones, that certain diseases just like osteoarthritis. Then underweight people, the patients taking some medications for long times, and who are using smoking and alcohol. Then what are the symptoms of osteoporosis? Weak nails, then bone fracture, stooped posture. Likewise, they are having a kind of symptoms. Then how we can manage them? Exposed to mild sunlight, because of the vitamin D deficiency, they may be getting osteoporosis. So we can ask that patients to be in mild sunlight in the early in the morning and daily oil massage, that whole body or the place. Then Svedana karma, Nasya karma, Shiravasti, and Rumhana therapy. Then we can ask them to avoid salty, fungal foods, then over exercises, too much walk, suppress natural urges, then alcohol. Then lot of patients, maybe they are having wounds because of their bedridden life, or if not because of some fractures or any other trauma. So they are getting mostly diabetic ulcers, venous ulcers, and pressure ulcers because of their prolonged diabetes conditions, peripheral arterial diseases, vascular diseases, radiation injuries. The thing is, while we are managing wounds, we have Shashti Upakrama. So we have to use the Shashti Upakrama according to the rationale, then we can give good relief for them. So next we'll move and see, they are mostly getting that kidney failure because of high blood pressure persistent for a long time, then high blood sugar, then reflux nephropathy, then polycystic kidneys, inflammation of nephrons, and because of long-term medications with their complications. Then what are the features or symptoms with their presence? Muscle cramps, breathlessness, excessive urine or not enough urine, itching of the body, nausea and vomiting. Sometimes they are getting bilateral lower limbs edema, persistence for a long time, likewise. So what are the risk factors for CKD? Hereditary, diabetes, hypertension, age over 60, then smoking. Then what are the management? We can do Virechana karma, Svedana karma, Mutra Pravartana Chikitsa, Rakta Prasadana Chikitsa, Agni Deepana Chikitsa, Sarva Dhatu Poshaka Chikitsa. Then what are the manage health problems of senior citizen? That means the whole thing, if you take in one umbrella, what kind of instructions we can give for them? They have to follow that Patyahara and Viharana as mentioned previous, sir. Then avoid Adhyashana Bhojana, avoid Viruddhahara, yoga practice, and Vyayama according to their ability, because some are not that much fit for all the exercises. Then they can use that Ahara Samskarana because of their appetite and because of their Ruchi and other all the things. Then Dharaniya Vega Dharana, that means mental Vega, they have to Dharana, and Adharaniya or physical Vega Adharana. Then they have to follow Dinacharya, Ratricharya, and Ritucharya. Then what are the Panchakarma for senior citizens? That previous sir also mentioned very nicely. They can use Matra Basti or Vata Shamana or Tarpana Basti with Tarpana Thaila or Vata Shamana Thaila. Then Thaila Abhyanka, either Sthanika or Sarvodayika, or internally also they can use. Then Svedana, that means Pottali Sweda or Nadi Sweda. Then Mrudu Virechana, that means Nitya Virechana they can use. Then Pratimarsha Nasya Karma, they can use till they are 80 years. Then what kind of Patyahara? Then they have to take adequate water for the day. Then fiber foods, protein-rich foods, vitamins and mineral-rich foods, milk and its preparations, Madura, Amla, Lavana, Bahula Ahara, fruits and vegetables. Then what are the Patya Viharana? They have to take their breakfast at 7 a.m., lunch at 1 p.m., dinner at 7 p.m. Then they must take balanced diet with Lagu Ahara, avoid Divaswapna, sleep by 9 p.m. to 5 a.m., good bath as much as possible, then proper toothbrushing, and wear clean clothes. This is the summary of my presentation. According to the Deha Prakriti, experience various kind of problems in late part of the life. Senior citizens getting some surgical problems due to complications of other diseases sometimes. And Panchakarma treatments are very beneficiary for them. In Ayurveda, Rasayana Karma available for them. Then they can use the benefits of them. Then balance mind and body, minimize physical and mental problems. By following Patyahara and Viharana, mostly prevent from more sufferings. Dinacharya, Ritucharya, etc. help to maintain good health in late period of life. Then this is the conclusion of mine today. Ayurveda lifestyle helps to maintain good health, and Ayurveda treatments give happy life in all ages. Thank you very much. Good night.
Great, madam. Very fast, loud and clear tone. Excellent. Please do join. Please do join whenever you have time. Please do join us. Please do join.
Thank you, sir.
Agnihotri sir. And before calling Agnihotri sir, I would like to communicate tomorrow's program only. We have 3 webinars tomorrow. We have initially, first of all, we have tomorrow is Madras Day. That is Madras Day, Chennai, history of and status of AYUSH. Dr. Srivan Narayan, Dr. Preena Jain, Dr. R. Shiv Kumar, and Dr. Hema Malini. Both will join, all will join us. And then Charak Sanhita Day 2, complete Vishwa Ayurved Parsad. If Joy is joined from Puducherry, please join and circulate this link to all VIP fellows. Dr. Govind Shukla, Surya Prakash Sharma, CP Sharma, Doveji, and BP Sharma will be guiding us on Charak Sanhita. And then a separate webinar on the same link will be for the condolence meeting, Shraddhanjali Sabha for Sri Ramharsh Singh Ji and GP Doveji. So tomorrow at 10 p.m. we are going to conduct condolence meeting for Sri Ramharsh Singh Ji and GP Doveji. Please do join tomorrow 10 p.m. And before that 10 p.m. we have 2 webinars, one on Madras Day and one on Charak Sanhita, Charak Paksh. Agnihotri sir.
Thank you, Professor Pawan Sharma ji, and also thanks for the informing all the program for tomorrow's webinar. Madam Gururatne ji were telling about a lot of deep informations. If this is the aspect, very naturally, this is rather an ideal approach by which, of course, Dr. Dhruv and Dr. Madam Gururatne ji both applied that what maybe the Vedan means ideally for the senior citizen. If it happens as far as the individuals are concerned, or the lifestyle, exercises, pleasure, and if deviated of sleep or lack of sleep is there, this all will be managed. Seniors will always be happy and will be showering their benedictions to us all. At the same time, if at all any surgical problem or any ailments take place, at the same time, the post-op nursing care and all the do's and don'ts are equally important. So very nicely presented by Gururatne ma'am. Thank you so much. And you are requested, please join us again and again. And this is IRES platform is yours, and Ayurved is, of course, you are Ayurved postgraduate, so it belongs to you. When you represent your whole country. So you are daily needed to our IRES. Thank you, ma'am. Thank you so much. Over to Pawan Sharma.
Thank you very much, sir. Thank you very much. Thank you, Dr. Dhruv, and thank you, Priyadarshini ji. Now I am going to request Dr. Tejan Singh Lingwal from Dehradun.
Though it's very late.
Tejan,
Though it's very late, it's just going to strike 11.
no problem. The 10-15 minutes, sir.
He's young enough to enjoy the webinars. And usually.
Dr. Tejendra, welcome. Welcome, Dr.
Namaskar, sir.
Namaskar.
Namaskar.
Namaskar. A very good evening to all of you.
Very smart.
Thank you, sir. Thank you.
He is smart.
It's visible, my screen. Okay. Namaskar. A very good evening to all the respected dignitaries. My name is Dr. Tejendra Singh, MD Scholar, Department of Swasthavita, Uttaranchal Ayurvedic College, Dehradun. Today we are celebrating World Senior Citizens Day. So as a student of Ayurveda, our topic is like we are focusing on Ayurveda part, Ayush care for senior citizens. Senior citizens are those who bring out the best in you and not the stress in you. World Senior Citizens Day is celebrated on 21 August every year to raise awareness of the contributions of older adults to the society. The origins of the day can be traced back to the efforts of the former president of US, Ronald Reagan. On August 19, 1988, the president issued a statement appointing August 21 as a National Seniors Day in an attempt to honor the senior citizens to the world. World Senior Citizens Day 2023 theme for this year is resilience of older persons in a challenging world. Actions we can significantly enhance the lives of senior citizens. The first thing, social engagement. Spend time with seniors, engage in conversations, and involve them in activities, what they want mostly. Second thing is assistance. Offer help with tasks like grocery shopping, paying bills, or running errands. Sometimes seniors need help, and we have to ask them if sir, you need anything, I can help you in that way. They will be happy. It will be like our honor to help them. Healthcare support, accompany them to medical appointments and ensure they are taking prescribed medications. Another one is technology assistance, because nowadays technology is like growing, and every day we are getting new things, new apps, new technologies. So it's better we can, instead of making fun of them, instead of making just like a joke of them, we can help them to learn, use digital devices, just like smart mobile phones and other things, to stay connected online, and they can also learn new things. Emotional support. Listen to their concerns, provide competencies, and be empathetic. And safety measures. Ensure their living environment is safe and hazard-free. Another one is awareness and sensitization. Educate society about the challenges faced by seniors and encourage empathy. Community initiatives. Participate in or organize community programs for seniors, such as social clubs or health camps, like some yoga classes for senior citizens, some awareness camps for senior citizens. Another is skill sharing. Encourage seniors to share their life experience and skills with young generation. Of course, these things will help for young generation. We can learn a lot of things from our senior citizens. Advocacy. Advocate for senior-friendly policies and infrastructure in our community. Elderly care services. Support or volunteer with organizations that offer elderly care services. Yeah, we can do according to our capacity, whatever we can do, help for them. Another is financial literacy. Educate seniors about managing their finances and availing government schemes. Because at after particular ages, after 60, 65, they are only depending on their pensions. So we have to educate them about the government schemes, about how can they manage their finances for their mainly health concerns. Education workshops. Organize workshops to help seniors citizens to learn about technology and other new skills. Healthcare initiatives like Ayushman Bharat provides health insurance coverage to vulnerable sections of society, including senior citizens. So it will be not burden for them as a financially. Maintenance and Welfare of Parents and Senior Citizens Act 2007. This act aims to ensure the maintenance and welfare of parents and senior citizens by their children and legal heirs. Residential care old age homes are established by both government and NGOs to provide care and support to elderly individuals. Concessions and discounts. Seniors are often eligible for concessions in public transportation, utility bills, and other services. Nowadays, many governments are giving free passes in buses and other transport facilities, to giving as honor, as a respect to the senior citizens. Ayurveda therapies for maintaining good health among senior citizens. Generally, previous speakers, Dr. Dhruv sir and Dr. Pritishniam already explained a lot of things like in a detailed way. So I'm explaining in short way all the things. So many things on Ayurveda, many therapies are prescribed we can prescribe for senior citizens, but these are the basic one. In daily life, they can have abhyanga. We can recommend them abhyanga, like daily massages. Even mild one they can do by themselves. Padabhyanga, it can be helpful for them just for sound sleep, because in Ayurveda it's recommended if someone is doing the Padabhyanga foot massage at bedtime, it helps to make having the sound sleep. And Griva Basti, because nowadays a lot of senior citizens, they have the neck issues, neck pain. For that thing, Griva Basti is wonderful. Kati Basti, if someone having the low back pain, is very common, like in after 60s and 70s. So for that thing, Kati Basti is very good. And joint issues, arthritis issues is very common among senior citizens. So Janu Basti is also very beneficial, providing strength and helping in their pain issues. So these therapies we can recommend to senior citizens. These are not like any cost bearing, not only the extensive therapies. These are very basic therapies. Even these therapies can be possible at home basis also. The Vata stage of life. In Ayurveda, there are three kind of stages. Like the childhood stage is like a Kapha dominancy. The young stage is Pitta dominancy. And the old age, means like the senior citizens age, is Vata dominancy. So we have to take care of the Vata. If already Vata is dominant in that particular age cycle, so we have to focus on their diet. There should be like a Vata balancing food, Vata balancing activities they have to do. So the first thing is put oil on everything. Means they have to, of course, apply oil in their body as like a bhanga on their navel button also. But food also, it should be like a with the ghee. If they are making any food with ghee, cooking oil with proper, not dry. They have to avoid dry food like the dry sprouts and salad. It's better if they can saute with olive oil or some other things. Eat more cooked foods. It's recommended for senior citizens if they will eat cooked foods. It will help in balancing their vata and also good for their gut health. And hydrate. They have to drink enough sufficient water to just maintain their hydration of the body. And meditate is better. Meditation is better for them because of due to vata, a lot of things happen like anxiety and stress issues. Already vata is dominant in this particular life cycle, this age group, and due to their other issues like they are worrying about their children's marriages, other health issues, and a lot of things. So it's like just for balancing that thing. If we can recommend them yoga nidra meditation, that will help. So of course, stress will be there, anxiety will be there. So if they will do at least 30 minutes meditation yoga nidra, it will help a lot to just like maintain their peace of mind. And other thing is make lunch their largest meal. It's better we can recommend them. They can just like as compared to breakfast and dinner, they can just whenever if they want to eat according to their appetite, so they can just focus on the lunch. Dinner should be the light like soup and a small quantity of some vegetables or dal. And the last and most important thing is stay connected to community, because in this stage what happened like they feel them like isolated from the society, because young generation is busy nowadays with their gadgets, with the social media, with their friend circle, and they don't have even time to communicate with their own parents and senior citizens. So they feel they are isolated, even like in a family gathering. They feel like nobody like no one have time to talk to them. So it's better we can tell them, and also we can do from our side, stay connected with them, just like just we can listen some stories from them, we can communicate in that way to them, we can just like learn something, some kind of their expertise, so it will make them happy also, and we can gain knowledge also. Few government schemes are there for senior citizens. One is AYUSH SAMRIDDHI Sammanas. It means a scheme of national award for senior citizens. If someone is doing good, if nowadays many senior citizens are also doing a lot of good work, like for educating society and some kind of trust basis things, like they are giving their expertise in according to their capacities. So government is also giving awards, giving the honor, giving respect to them. Second is Indira Gandhi National Old Age Pension Scheme. It's very common after particular If someone is not a government employee, even government used to give them a particular amount of pension. The third one is Atal Vayo Abhyudaya Yojana. It also gives some kind of like a money amount to the senior citizens. It helps in their financial issues. Treatment cover for senior citizens. Nowadays, AYUSH also covered in insurance. Earlier, it was a big concern. Already, they have a lot of issues, generally citizens, the pain issues related things, and other some gut health related issues. So in allopathy, they are already tired with their own issues, and they are not capable, and they are not happy with those allopathic treatment. So nowadays, AYUSH also covered in many insurance schemes. The treatment expenses under AYUSH is very less as compared to allopathy's treatments. AYUSH treatment is highly effective and beneficial. They will see the changes and some add-on benefits instead of the side effects. AYUSH treatment method is considered to be one of the best for the senior citizens. Of course, it take care of their health. It manage their chronic issues and also maintain their health. AYUSH cover is easily available to individuals in various locations across India. So nowadays, government is also doing many things for senior citizens. These are few things related World Senior Citizens Days quote. It's about only just awareing about this particular day. Aging is not lost youth, but a new stage of opportunity and strength. By Betty Friedan. The longer I live, the more I realize the impact of attitude on life. Attitude to me is more important than facts. By Charles R. Swindoll. Old is not a disease. It is a strength and survivorship trump over all the kind of disappointments, trials, and illness. By Maggie Kuhn. Age is an issue of mind over matter. If you don't mind, it doesn't matter. By Mark Twain. Growing old is mandatory, but growing up is optional. By Walt Disney. Old is like everything else. To make success of it, if you have got to start young. By Theodore Roosevelt. So lastly, I wishing you everyone a very happy Senior Citizens Day. And as a part of conclusions, I will conclude my whole thing in this way. Nowadays, everyone have the medicine part. If someone having, I'm talking about senior citizens, if someone having pain, they have the medicines part. They have good food. But the thing is, they want a connection. They want someone need to talk to them. Someone, they want the attention, the pamper same they gave to their children during the early age. So if we will, as a young generation, if everyone give at least particular time to their own parents, their citizens, earlier senior citizens, to dear and near ones, so they will not feel that kind of loneliness. Of course, everyone have monies and those support, but they need that kind of affections. So if everyone will think like this, and everyone will take care of their parents and their elderly family members, so old age home, this concept will be not there, just like our old Indian tradition. So my biggest thing is everyone is take care of their parents, family members in that way, just as a think we will be in that age after few years. So just give our little time to them, just talk to them in happy moments, like sharing the things in that way, they will be happy. And of course, if they will happy, of course we will be happy, and we will get the blessings of our parents, our relatives, our senior citizens. Thank you so much, sir. Thank you, Dr. Pawan Sharma, sir. Thank you, Dr. Mitri, sir, for giving me this opportunity.
Thank you very much, Tejendra ji. Thank you very much. I really salute the creativity of Ayurvedic experts. Just see the example right from Dr. Dhruv Prasad. Excellent presentation on different aspect. Then Priyadarshini ji, absolutely different. And you, excellent. I have observed really in these 35 years of my working experiences that the father and parents who have developed or groomed their children in best way, they have died alone. Unfortunate. This is absolutely. I'm in Bhopal. This is the capital. I was in Calcutta. I'm in Calcutta. My residence is in Calcutta. Approximately 50% senior citizens are really waiting for somebody who can give them a glass of water. A glass of water with love. That's, please, I am there to help you. Nobody is there. They have enough money. They have house, they have money, they have vehicles, they have son and daughters studying or working outside of the city, but they don't have any companion to talk with. That is the topmost problem. Agnihotri.
Thank you. Thank you, Dr. Professor Pawan Sharma ji. Dr. Tejendra, you put forward so many very touching points with a special reference to the care of senior citizen. Your one word before your closing told that stay connected with the community. Really you told, but why this sentence came as a necessity? Because as the grandson and granddaughters are the most energizers of the senior citizen. But the problem is either our progeny not going for the progeny, not going for the their kids because of lack of time or avoiding from the responsibility, or they are not allow their kids to meet their grandsons because of the either very important part. I am just reading after listening whole the thing. Either because of the overburden of their ambitions to be fulfilled by their products like swimming, horse riding, skating, dancing, everything, or else go to sleep, go to breakfast, everything. It's very, very difficult that the grands and granddaughter come to their grandparents and say, Papa, Nana, Baba, what you are having information regarding our spiritual aspect like Rama, Krishna, Ravana, who they were and what are the stories which they are getting from the. So they should be allowed to come to the grandparents, or they should go for the progenies, so that we will be having a pleasure that we have our sons and they are having their sons or their progeny. This is very important. And because of the lack of this thing, you told that stay connected with the community, because community is the third party where we can share the problem. Their knowing females are also going for kitty parties simply because of the just sharing or getting some assembly or having some relaxation at their mental level. So goes the case with the gents, because they are all having fulfilled the responsibility and they are not dependent upon as far as the financial is concerned. So this is very important point you can add on this thing. Thank you so much for your putting forward a very, very important thing.
Thank you so much.
And my pleasure that you are still with us at 11, quarter past 11. This is what we have a proud of it. Thank you.
मैं आज सबसे पहले डॉक्टर रमाकांत राउत जी को इनवाइट करना चाहता हूँ।
मैंने कहा
है ना सर?
बिल्कुल, मैं भी इंतजार में हूँ।
डॉक्टर रमाकांत राउत जी, स्वागत है, स्वागत है, स्वागत है।
प्रणाम प्रणाम आप सभी लोग जी, आप सभी लोगों को प्रणाम।
जी नहीं है, अपन हिंदी में आराम से बात करते हैं।
नहीं, आपने भेजा ध्रुव को तो आप तो रहेंगे ही रहेंगे, एक मेंटर के तौर पर, एक बड़े के तौर पर। जी स्वागत।
मालिक राउत जी है, मैं क्या कहूँ, मालिक वो है
जी। आप लोगों का आशीर्वाद है और वो आशीर्वाद हम सब समय में हम चाहते हैं, और आप लोगों के आशीर्वाद से हम भी आपके साथ जुड़ करके मुझे बहुत आनंद मिल रहे हैं।
जय हो। आपको बहुत बहुत धन्यवाद कि आपने ध्रुव जी का परिचय कराया, आप आए। मैं तो चाहता हूँ आप लोग सब साथ में रहे।
और आज 3-4 लोग ज्वाइन किए हैं, और आगामी चरण के लिए एक स्पीकर आपको कल वो आपको उनका नाम दे दूंगा, वो भी स्पीकर के लिए चरण के लिए वो एक दिन वो
नाम फोटो डिटेल दे दीजिएगा। 24 या 25 को उनका रख लेंगे अपन
जी।
23 तक का बुक हो चुका है।
ठीक है।
सभी लोग अपनी संस्थाओं के मौलिक सिद्धांत के विभाग के प्रोफेसर और चरक को पढ़ाने वाले उन सभी अध्यापकों का हमें अनुभव प्राप्त कराने के लिए उन सबको भी जोड़िए, अच्छा लगेगा। और आपका ये
ठीक है।
आपका पंद्रह का कार्यक्रम है, इसको सफल आपने ही बनाना है।
राउत साहब का सब्जेक्ट क्या है?
संस्कृत।
अरे गजब है, गजब है, गजब है राउत जी। अच्छी अच्छी सीरीजें शुरू कीजिए।
वो भी बीएचयू से है भाई, ये तो हमारी तो ऐसी शाखा प्रशाखा आपने प्रोफेसर पवन शर्मा जी ऐसा जोड़ा है, मैं जिनको जानता नहीं था वो हमारे संस्कृत के परिवार में वृद्धि हुई है, गजब की वृद्धि हुई है।
नहीं मतलब
आप तो मेरा सीनियर है, आपका बीएचयू का फर्स्ट सेकंड बैच है, आप तो मेरा सीनियर है, आपका गुरु जैसे है।
मैं तो पहला हूँ ईश्वर के पास से, मैं तो पहला हूँ जो जुड़े। आपको मैडम नीरू नथानी जी ने हमको बताया, बहुत अच्छा लगा। हमारे जितने संस्कृत के व्यक्ति हमसे संपर्क में आए हैं, ईश्वर के पास से 75 to 90% लोगों ने जुड़े हैं। और लेटेस्ट देखिए अभी हमारा तेजिंदर जुड़ा है, वो भी संस्कृत से एमडी कर रहा है, तो खुशी की बात है। तो आते हैं आगे, सबका स्वागत है। चलिए सर, आज के आशीर्वचन लेने की हम एक बार
रमाकांत जी, मेरी बेटी श्री श्री में ही पढ़ रही है
जी।
मेरी बेटी श्री श्री आयुर्वेद में आपके इसमें
वो तो बेंगलोर में,
बेंगलोर में।
बेंगलोर
फाइनल ईयर में।
अच्छा। हम जो बैंगलोर जाएंगे वो तो इसी साल, वो तो 2000 ये तो 15 days बिफोर आई हैव टू go Bangalore, but cancelled due to some problem. I cancelled the ticket. Next, in coming within 2 months, I also go to Bangalore and also visit the Sri Sri University. Then I also meet your daughter.
आदरणीय श्री श्री के आशीर्वाद से, क्योंकि आदरणीय श्री श्री गुरुदेव के इमामी परिवार से बड़े अच्छे रिलेशन है। इमामी पर मैं 33 साल रहा, एज वाइस प्रेसिडेंट रिटायर हुआ। आपकी श्री श्री आयुर्वेद, हम लोग वहाँ टेक्निकल कंसल्टेशन देने जब वो स्टार्ट हुई, उसका शुरुआत से लेके प्रोडक्शन शुरू कराने तक हम लोग वहाँ थे, और हम लोग स्टार्ट करके हैंड ओवर करके दे दिए।
अरे आप तो हमारा गुरु जैसे हैं।
इमामी झंडू,
मुझे कुछ कहना था
जी।
विवेक सर, अग्निहोत्री सर को तो मैं बस शिलोंग में मिला था। शिलोंग में अग्निहोत्री सर को याद है कि नहीं पता है, हम गए थे शिलोंग।
आप म्यूट है अग्निहोत्री जी, आप म्यूट है अग्निहोत्री जी।
अच्छा, आप शिलोंग वाली सीएमई में आए थे आप?
अच्छा जी सर ममता मैडम मैं।
हाँ, अच्छा। हमें तो रावत साहब ने दोबारा से आपसे जोड़ा है, और अच्छा लगा। वहां तो हमने सबको अपना दिया ही था कि आप कनेक्ट होइए हमसे। अभी संस्कृत की संभाषा हो रही है परसों 23 तारीख में विश्व आयुर्वेद परिषद तरफ से, तो उसमें आप उसमें आप जुड़िएगा दोपहर 2:30 से। जी, तो आदरणीय प्रोफेसर लक्ष्मण द्विवेदी जी का आमंत्रित करता हूं कि अपने आशीर्वचन देके आज के तीनों ही वेबिनार्स का समापन करने की आप व्यवस्था करिए। आपका स्वागत है। स्वागत।
धन्यवाद अग्निहोत्री सर।
प्रणाम सर। अरे सर मत कहिए सर, बालक हैं आप।
तो बहुत अच्छा रहा। अंतिम वेबिनार में वार्धक्य के निवारण के लिए और होने वाली व्याधियां और उनके मैनेजमेंट के लिए जो वक्ताओं ने सुझाव दिए वो बहुत अच्छे हैं, किंतु फिर भी जो सामाजिक परिवेश में जो सुझाव हैं वो वास्तव में फॉलो करने लायक हैं कि साहब हमको वास्तव में समाज से दूर नहीं रहना है, और जब समय जो है उसको पूरा उपयोग करें और अपने शरीर के स्वस्थ व्रत का ध्यान रखें तो आदमी दीर्घायु होता है। और ये उन्होंने लिखा है जो चरक में गाइडलाइंस वगैरह सब, उसको फॉलो करने पे निश्चित रूप से पूर्णायु प्राप्त होती है और सौहार्द भी बना रहता है। इसी के साथ में शुभकामनाएं। धन्यवाद।
आपको बहुत विलंब से कष्ट दिया, 11:15 से ऊपर हो गया। आज तो बस अब चरक जी की आज जयंती शुरुआत हुई है तो थोड़ा समय अधिक लग गया। आपका बहुत बहुत हृदय से आभार। और आज के सभी तीनों वेबिनार के हमारे
शैलेश जी हैं, अभी शैलेश जी अपने तक जुड़े।
हाँ शैलेश जी तो अच्छा, उनको हमें सर्टिफिकेट का लिंक भेजना है। हाँ जुड़े, हाँ आइए स्वागत।
हाँ प्रणाम सब लोगों को बहुत प्रणाम। इतने
सभी
बड़े
लोगों
बड़े
को प्रणाम।
वक्ताओं को सुनना और खास करके आज के दिन मतलब चरक जयंती के दिन जुड़ना बहुत बड़े सौभाग्य की बात है। लगता है कुछ परिवर्तन मेरे जीवन में होने वाला है जो जुड़ पाया हूँ और तो बहुत
अभी
बढ़िया लग
अभी
रहा है
आप
मुझे। जब भी
कलकत्ता पहुंच रहा हूँ, चले जी।
अभी आप सुश्रुत
अच्छा।
जयंती से जुड़े थे, अब चरक जयंती जुड़ गए हैं। अब देखिए ना कितना आप आयुर्वेद में होते जा रहे हैं। मनसा
जी जी
वाचा
बिल्कुल
कर्मणा हो
बिल्कुल
जाएंगे आयुर्वेद से।
बिल्कुल बिल्कुल।
ये आपका
आजकल तो अब मेरे
जुड़ाव,
सिरहाने में ये तो मेरे सिरहाने में ही रहती है पुस्तक जो है
वो तो आपने दिखाई दिया।
क्या
आपने
बोल
कहा
रहे हैं।
एमबीबीएस में जाने से पहले ही हमने जो है अष्टांग संग्रह, अष्टांग हृदय का जो है स्पर्श कर लिया था। हमारे लिए तो वही बहुत है।
जी जी
वो आपको दिशा निर्देश देते रहेंगे और जीवंतता है उनमें। आचार्य तपन जी ने आज ही बतलाया है। उनको
वो
उनको
बहुत बड़ी
साक्षात
बात कही सर। वो व्यक्तित्व की
बहुत बड़ी
तरह जो
बात।
उन्होंने कहा कि
और
बहुत बड़ी बात, बहुत
जो
बड़ी।
सिमली दी है उन्होंने आज के मोबाइल से, और सिमली का अर्थ समझना जरूरी है। ये आर्टिफिशियल इंटेलिजेंस से हम कहीं पहुंच सकते हैं, तो वही चीज यहाँ भी है और पहले जमाने में ही होता रहा होगा।
उनकी बातों
बिल्कुल
से
बिल्कुल।
एक कंसेप्ट क्लियर हुआ सर। जब ऋषि संभाषा हुई थी तब योनिज और अयोनिज, ये
यह है
कितना
बिल्कुल।
छोटा शब्द है। अयोनिज माने रोबोट। कहां से कहां की बात को कोरिलेट किया है, क्योंकि वो जन्म नहीं
जी जी
लिए, वो तो आर्टिफिशियल
चल रही है।
इंटेलिजेंस है। इस बात
जी
को ये इंटरप्रेट करना भी बड़ी बात है सर।
वो बहुत बड़ी बात है, बहुत बड़ी बात, बहुत बड़ी बात, बहुत बड़ी। आप कलकत्ता हैं तो मुलाकात हो सर, अब जब भी कलकत्ता।
मैं 26 को पहुंच रहा हूँ। 27 को थोड़ा व्यस्त हूँ। 28 से लेके 12 तारीख तक कभी भी अपन मिल सकते हैं और
हाँ हाँ
जरूर
चलो,
मिलेंगे।
मुलाकात होगी जरूर, जरूर जरूर मुलाकात
वहां
होगी।
की भी नहीं, वहां की भी कुछ बातें करना है। मैं
जी
इथिक्स कमेटी का, मैं इथिक्स कमेटी है जिसका मैं मेंबर सेक्रेटरी हूँ,
जी
CDSCO
जी
अप्रूव्ड। तो उसमें आप आइए साथ में, हो वहां संभालिए,
जरूर
क्योंकि मैं भोपाल में हूँ।
जरूर।
आप संभालेंगे तो बहुत आगे बढ़ जाए।
जी जी बिल्कुल बिल्कुल। ठीक है सर,
जरूर मिलेंगे।
चलिए सर, सभी का आभार, सभी का स्वागत।
आप रहते कहाँ हैं?
मैं रूबी हॉस्पिटल के पास, बिल्कुल इमामी के बगल में, रूबी हॉस्पिटल वाले रोड में ही
अरवाना?
हैप्पी नुक बोल के सोसाइटी है। हैप्पी नुक सोसाइटी सर, पहला सोसाइटी है राइट साइड में, अरबाना के बहुत पहले,
हाँ,
उसी रोड में।
मैं बोसपुकुर के पहले स्टॉप पे, एक्रोपोलिस के बाद
जी
उसमें त्रिवर्ण संघ पे रहता हूँ।
हाँ हाँ समझ गया जी, समझ गया, दिख रहा है जी, बहुत
चलिए,
पास में।
गुड नाइट सभी को। गुड
शुभ
नाइट।
रात्रि सर,
तोमर
शुभ
जी
रात्रि।
जुड़े हैं कि जगह नहीं, एक
सभी
हाथ
का आभार, सभी का
राउत